groundwork for me. I'll keep it quite short. I was on the, I have no disclosures for this talk. I've used TOPS now as part of the IDE trial. Strong believer, very, very pleased with the technology. So the technology is FDA approved, and the question is, of course, for today's discussion, does the technology provide preservation or restoration, if you will, of the disc space? So, the whole premise of TOPS was to find a stabilization type device, that maintained at least, if not restored, but as it turns out, it maintains motion while not forcing the patient to have a fusion. And is there any evidence that there's a secondary benefit that this technology improves the disc and the nucleus pulposus? What TOPS unquestionably has shown is that it provides stability, mobility, and superb clinical outcomes compared to the control group in the randomized prospective FDA trial, control group being fusion. I'm going to show this set of slides again in about 60 seconds or so, but I just want you to look at the disc movement. Obviously, there's no disc movement with the fusion, but the disc movement with the TOPS device does look pretty normal there. And I want you to look at this slide as well. Pre-op and post-op TOPS devices. Just focus not on the device itself, but on the disc. The disc at 4 pi looks quite good. It looks reasonably well preserved over the 24-month time period. Anecdotal, but I think it's something that bears some discussion. So I'm not going to go into the FDA study. This has been published in multiple different ways, and I've discussed it in multiple different forums. But it was a very strongly powered trial, highly safe. The FDA did not require a panel review of it. Got FDA approved, and it's FDA approved now as a non-instrumented motion preservation device for single level pathology between L2 and L5. I'll go over the group that I think is most benefits with this mostly, but it's for patients with degenerative spondylolisthesis, not isthmic spondylolisthesis. And it works. That's as simple as that. I'll go through some of these composite results. It works extremely well. Works well compared to fusion, works well compared to non-fusion in other studies as well. And it doesn't restore, it maintains the patient's preoperative mobility. So I asked the company, I asked myself, what evidence do we have that this preserves the discs or the nucleus pulposus? The company, of course, has done the standard range of motion test and biomechanical test. Turns out as they did this, they did include a measurement of intradiscal pressure. So again, this was the picture that I just showed you, the movements, and you can see the angular movement at 24 months is 7.4 degrees, which is quite good and quite well preserved. And I would argue that the disc space at L4-5 here has been quite preserved over the past 2 years. This is a chart of the standard average, if you will, intradiscal pressures through various activities, and as we all know, of course, bending at the waist creates the highest pressures. So the direct biomechanical testing did look at pressures in the disc between all these movements, and I just showed a couple. But what I did want to show is that if you take the intact spine, you create defect, you get these larger changes in pressure with movements in axial rotation and other movements. But once you stabilize this segment with the TOPS device, you obtain or reobtain almost completely normal pressures in the disc. And I would argue that this is, at least in axial rotation and in flexion extension, TOPS does function as a nucleus or intradiscal preservation device. I don't think it's magic. I think it's just what Lisa showed. I think it's just you've now created controlled movement, normal stability, and it's no surprise at all that once you do that, you're going to get lower intradiscal and more normal pressures. So, how do I use TOPS in my practice? Spinal stenosis, grade 1, maybe grade 2 spondylolisthesis. They have to have some disc height to be present. The patients typically will have more leg than back symptoms. I don't limit myself to 70. I'll go up to 80 years old. Key elements is the patients I have yet to do, no pars, fractures. I haven't done that. I will say, since it's been approved by the FDA, the company has an add-on device that does allow you to do a fusion at one level and TOPS at the other level, which might help in certain circumstances where you want to fuse, say, L5S1 and provide a non-fusion motion preservation at the L4-5 level. With that, I would say